Hi, my name is Jason Long, and I am here to give a brief presentation on an integrative review of literature over CHF Nurse Intervention in the care of the CHF patient. Just an introduction into the condition. We all know that it is progressive disease that occurs when the heart is unable to pump sufficiently to maintain the body's needs. CHF is a major public health issue with a prevalence of over 5.8 million in the U.S. It is a major source of health services utilizations, a leading cause of hospitalizations, readmissions, and outpatient visits at a cost of over $39 billion annually in the U.S. Further background, it is preventable hospital readmissions is an increasing priority in U.S. healthcare policy discussions. Congestive heart failure is the most common diagnosis in hospitalized patients aged 65 years of age and older. And reasons such as noncompliance with treatment, lack of knowledge suggest that many admissions and readmissions can be prevented with a proper plan of care and adequate teaching. Therefore, we have the clinical question: in hospitalized heart failure patients over the age of 65, would education by a heart failure nurse compared to education by a staff nurse reduce readmission rates within 30 days for heart failure? Theoretical framework: patient characteristics and shortfalls in healthcare delivery system often lead to a deficit of optimum care in the CHF patient. Generalized floor nurses lack the dedicated time and specific training required for this type of patient, and results from insufficient patient education is seen in noncompliance and recurrent CHF exacerbation. I chose 4 studies to review. Each of the 4 studies were able to show a decrease in hospital readmissions by specific CHF education programs. They were also able to show a decrease in the cost and an improvement in overall quality of life. Highlights from Marie Lassiter in 1996 at the Medical University of South Carolina. She was able to show an increase in patient knowledge on their education of meds from 40 to 82%. In 2001, at the Western Infirmary, Linda Blue conducted a randomized control study in which she was able to show a decrease in hospital readmissions for CHF exacerbation from 53% to 37%. Dr. Michael Rich in 1995 as well at the Jewish Hospital was able to show a decrease from 54 to 24 in CHF hospital readmissions. And lastly, Dr. Todd Colling at the University of Michigan Medical Center conducted a 1-hour in-person teaching session with a nurse educator to the usual discharge. He contacted patients at 30, 90, and 180 days post-discharge, and he was able to show an overall lower risk of readmissions, cost of care, and was able to show an increase in the quality of life in these patients. So proposed nursing interventions for facilities admitting CHF patients would be to enroll the patient at time of admission to a specific CHF program supplied with a CHF brochure and folder, daily education by a designated CHF nurse specific to diet, exercise, weight management, and meds. We would also need to require the patient to use verbal understanding of medications and signs and symptoms of the disease. And at time of discharge, we would need to provide education by a designated CHF nurse. Conclusions from the integrative review shows that concerns about CHF patient hospitalization, readmission, patient knowledge, and patient teaching should be mitigated by findings from this review. Study results indicate a lower incidence of hospital stays, cost of care, readmissions, and overall improved quality of life in this client population when interventions are performed by specially qualified CHF nurse programs. Facilities admitting and caring for this unique population should have in place specific clinical resources to help educate, discharge, and follow up on these particular patients. Thank you for your time.